This is the important bit. We get the patient to put their foot on their heel so that it's nice and loose, okay? If you have a patient with their foot is firmly on the ground, you're not going to see the twitch as quick, okay? So nice and loose. Then we find the fibular head, okay, the bony prominence at the side of the knee here, okay? So you can go out from the knee laterally, or you can go up and feel up the leg to the bony prominence, okay? Put your foot back for me. And then we have to line the blue dotted line on the fibular head. And you just use the self-adhesive to fit around the leg. It fits any shaped limb, okay? So it doesn't have to go all the way around, it just has to sit with the blue dotted line over the fibular head. You then press to get a twitch of the foot, a visible twitch, okay? So you just keep turning it up.
Would you like me to remove my shoe?
No, that's fine. Can you feel it? Is it getting stronger?
Up until my calf.
Yeah, okay. So we just turn the device up until...
You can see the twitch.
So you can see a really good... Can everyone see that calf movement?
How does it feel? A little compression.
Yeah? I'm just going to turn it up once more just so that we can get a twitch of the foot.
Yeah, I can feel
There you
it.
go. But this is really, really... So let's say you've got a fixed ankle and this is not twitching. If you can see this, you know that you're moving blood, okay? Because it's pumping that muscle. So if you now imagine you've got compression therapy on, okay? Really nice and firm, that venous return is going to be going like that and working with your compression therapy. Okay. So what we do is now turn it down to make sure the patient's comfortable, okay? So you know you're in the right place. Okay, and then we would get a pen and we would mark the blue dotted line for the patient. Remember, this is supposed to be self-care, okay? This isn't asking nurses to go in every day and turn this device on for them. This is a self-care device. So we mark it so that the patient can see where to put it the next day. So they wear it for 12 hours, they then turn it off after 12 hours or it turns itself off. And then they would put it to one side and use the same device the next day, but they just line it up with this dotted line. So it's so easy for the patient, they know exactly where to put it.
As a marker.
But that's a really nice calf muscle pump you've got.
Yeah.
Okay.
Just let it sit there.
And I think yours is on level 4, right?
How did you know what level it is?
So,
You have
So
to
It
you
says
get-
7 or...
That's a 4, you
You have
count
to
the
count.
flashes.
yeah, it's on level 4. 4 flashes.
4.
Yeah.
Okay.
So you can go up to level 10, and there'll be 10 flashes. But if you get a twitch on level 1, that's
There's a
enough.
twitch already on
Oh,
my foot.
okay. If we, as long as we get the twitch.
Yeah.
And the patient seems comfortable.
So Mercy, with our patient, she's at level 7.
Yeah.
We can actually lower it down.
Yeah.
Do you want to come and
Just so
try
that
it?
she'll feel 12 hours.
So each device lasts for 12 hours from the time you turn it on, okay? The patient can then turn it off or the battery will just stop working after 12 hours. You then take it off and pop it onto the backing sheet. You
Okay.
pop it aside for the next day and then you use the same device on day 2. After 2 days of wear, that's it done. You throw it away
Oh.
and you get a new one
Oh.
out of the pack.
2 days.
So you will use it maximum of 2
2 days.
12 hours.
12 hours each day.
12 hours the next day.
Yeah.
Done.
So you have a pack with 7, so that's enough for 2 weeks.
How much would each pack?
230 pounds for 2 weeks.
Because I'm thinking, like in my case, I've got venous insufficiency, but as you can see, my legs are intact. But I've got venous insufficiency, which means some portions of my distal region isn't reaching enough. It's not reoxygenated, and in return, I would have pain on my calf area. So this would work as well for me because it promotes circulation.
Yeah.
That's why I wanted
All
it
we're
on.
doing is mimicking a patient walking without them actually physically walking and exercise. So we are pushing that blood. So if you think of arterial wounds, okay, where there is a blockage, we help arterial wounds as well because the blood finds a way round the occlusion and it builds collateral, okay? So you will still enhance blood flow in arterial patients.
Can you also buy it even if it's not prescribed?
You can buy it. You can buy it from Day Long Direct.
Weight?
If it's for-
We'll get to the very expensive bit. It's not
Oh.
very expensive at all.
Mm-hmm.
Okay, so if you've got a patient that's wearing trousers or they're quite mobile, you might want to put a cover on it. This basically keeps it in place for the 12 hours, okay? You get a pack of these in your prescription pack, and all you do is you place it over the top to keep it in place.
Yeah. So we have a patient in the nursing home, that patient. So what I do is I ask the nurses to put it, this is day one today, so that whoever is taking it off knows to put it back on the backing sheet for day two.
Yeah.
Yeah, so because if you are not the same person doing it,
Yeah.
if you're the patient, you know it's day one, but some patients may forget, so it's always good to write also on your booklet, this is day one today. You know, the next time you put it, it's going to be the same device twice, because otherwise, if you dispose of it, these are very expensive in terms of cost, individual. Because initially we had problems. The nurses were putting one throw away. So it was lasting 1 week instead of 2 weeks, which is very costly. Yeah.
So what you can do, and it's good practice to do, is just if you're using these covers, just write on it day one and what time you put on, because you can easily write on the on the cover. Okay.
Yeah.
So day one and what time you turned it on, so your next carer will know.
So like when I go to the nursing home, if they haven't applied it when I get there and I apply, I'll just say apply by TVN at 11 a.m. so that they know at 11 p.m. they have to take it off. And you can leave a break of 6 hours in between taking it off, and then you can restart again. But generally, we always say stick to the same time if possible. So in the nursing home, what I've told them is the first thing in the morning, they always put it at 10 o'clock in the morning. They finish their drug rounds and everything, they put it on at 10 or between 10 and 11 a.m. And the night nurses will take it off because they can see what time it was put on. It was at 10 a.m., they take it off at 10 p.m. And then they start the same thing again. And you clean the area each night when you take it off. You might need to apply barrier cream around the area to protect any, So you do your normal routine skin care around the area to prevent any irritation, because you might start getting some irritation. And when you do get irritation, you can rotate. There are other sites. So we have site A and B, and then site C, which is just above. Yeah. Yeah?
Here?
Yeah. It's
a
in
little
the
bit more
booklet.
tricky to find.
Yeah.
But you can do it.
But when you put it in here, you would also see the...
You will,
trigger.
yeah.
Okay.
Yeah. I've actually got my videos of my patient I can show you on site C. Yeah, I'll show you on the phone here on Isla. Yeah.
Okay.
So let's just address the cost issue. Somebody said it's expensive. Who was that? Who's going to own up? Was it you? Okay. Right, this is the cost here, okay? So it's for one leg, it's £230. So for 2 weeks. For 4 weeks it's £460. For 6 weeks it's £690. What we know is most patients need 6 weeks, between 4 and 6 weeks, okay? If I then go back to what I just showed you, which is this one, okay, we can evidence that we are way more cost effective than standard of care alone if you're not healing that patient. So we have a patient that had a leg ulcer for 20 years. It cost the NHS over £100,000